The fluorescent lights hummed overhead like an electrical heartbeat as Elena Martinez pushed through the double doors of Cedar Creek Medical's trauma wing at 11:38 p.m., her badge catching the pale glow with a quiet click against her sternum. The night air still clung to her scrubs, October rain, diesel from the ambulance bay, the metallic tang of the city at the edge of November. She moved through the corridor with the kind of efficiency that made her invisible to the hierarchy, her shoes silent on the tile despite the weight of what she carried. The trauma wing at Cedar Creek never truly slept. It breathed. The ventilators wheezed their mechanical rhythm from the isolation rooms, monitors beeped their steady percussion, and somewhere down the hallway a resident was getting yelled at by an attending, the same attending who'd been yelling at residents for the past 6 years, the same attending who still believed volume was equivalent to competence. Elena's hands were steady as she signed in at the night desk, steady as they always were, steady in a way that no amount of coffee or insomnia could explain. 23 years of muscle memory didn't just disappear because you got a fake diploma and a nursing license purchased from a man in a parking garage in Allentown. 23 years lived in your bones. It lived in how you moved, how you breathed, how you calculated distances and trajectories without thinking about it. She made her way to the locker room on the 3rd sublevel, the place where the night shift nurses kept their other lives. Lockers lined the walls like grey metal teeth. Most of them held the detritus of civilian existence, phone chargers, energy drink cans, a Costco-sized container of ibuprofen, pictures of children and husbands and dogs. Elena's locker contained only what was necessary. A change of scrubs. A coffee mug that said nothing. And deeper, buried beneath the spare compression socks and the backup stethoscope, a pair of worn combat boots. She pulled them out and held them for exactly 6 seconds in the fluorescent glare. The leather was cracked across the heel where it had been patched twice. One eyelet was missing on the right boot. The soles were scarred with the particular damage of running through 3+ miles of Taliban-controlled terrain in Helmand province, specifically the Marjah district where the clay turned red if you looked at it long enough, where every building could hide a weapon, where the smell of dust and burning diesel meant someone's convoy had just been hit. The boots had a name written inside in fading black marker, Martinez. Not Master Chief Petty Officer Elena Martinez. Just the name. Just the rank that officially didn't exist anymore, that the Pentagon had ordered erased from every database, every personnel file, every official record the moment Operation Nightfall went catastrophically sideways in 2019. The operation itself was buried so deep that even FOIA requests bounced back with redactions over redactions, black ink on black ink on black ink. She returned the boots to their hiding place and stood there for another moment, her hands resting against the locker door, breathing in the smell of industrial cleaner and other people's forgotten lunches. The trembling came sometimes in private moments like this, not fear, never fear, but restraint. The kind of trembling that happened when you were holding back everything that wanted to explode outward. She let it pass through her like a wave, waited for it to subside, then turned and walked back upstairs. The ICU occupied the entire east wing of the trauma floor. 28 beds. 17 of them currently occupied. Elena collected her assignment sheet from the charge nurse, Diane, day shift holdover who was always too tired to ask questions, and scanned the patient names with the rapid processing speed that came from too many years of triage and assessment. Room 347 was third on her list. Staff Sergeant Derek Moss had been admitted 41 hours earlier after a motorcycle accident on the Schuylkill Expressway. Head-on collision with a box truck. The box truck had won. Derek had come off his Harley at 53 miles per hour and his head had hit the guardrail first. Traumatic brain injury. Epidural hematoma requiring emergency decompression. Fractured left radius. Contusions across his ribs and abdomen. The doctors said he was lucky. Elena knew better. Lucky didn't apply to Special Forces operators with permanent memory damage and eyes that looked through you like you were glass. She entered his room and the monitors immediately registered her presence, blood pressure steady at 128/76, heart rate holding at 71, oxygen saturation 98% on room air. The medical data told one story, recovering. The sight of him told another. Derek was asleep, his left arm draped across the top of the blanket. On his bicep, in letters so crisp and well-maintained they looked freshly tattooed despite their age, was her name, E. Martinez. 13 letters. All caps. A permanent tribute to a woman he no longer recognized, a woman he'd carried supplies for, a woman he'd watched reposition him 3 times in the field when he'd started seizing from his first head wound, a woman who had been very real once and was now a ghost wearing borrowed credentials. Elena checked his full line, verified the antibiotic drip was running at the correct rate, and made a note on his chart in handwriting so carefully neutral it could have belonged to anyone. She did not touch the name on his arm. She did not acknowledge that it existed. "You're new," Derek said, his voice sandpaper rough from the ventilator they'd had him on for the first 36 hours. His eyes were open now, fixed on a point above her left shoulder, not actually seeing her. Traumatic brain injury did that, created the appearance of consciousness without the presence of awareness. "Night shift nurse," Elena said, her voice low and steady. "Has your pain level?" "Who is that?" He was looking at the tattoo now, or trying to, his head moving with a kind of stilted effort that suggested significant cognitive impairment. "Why is there a name?" "I don't remember." "Head injury," Elena said. She was good at this conversation. This was the conversation she'd had 47 times in the past 2 years, in hers from Delaware to New Jersey. "Your body remembers. Give it time." She left his room and continued down the hallway, knowing that Derek would not find her again in his memory, that he would ask the next shift nurse the same question, that the tattoo would remain a mystery to him for however long it took for his neural pathways to either reconnect or accept their new limitations. This was her bargain with the universe. She saved them. They forgot her. Fair trade. The rhythm of the night shift took over then, the predictable, meditative sequence of checks and medications, the constant low-level scanning for deterioration, the way the monitors all spoke in their own language if you'd learned to listen. Elena had learned to listen in a place where listening wrong could cost you your entire team. A Humvee engine changing pitch at 400 meters meant an IED trigger man was preparing to detonate. A radio operator's breathing pattern meant contact was incoming. A room full of monitors meant a patient 3 minutes away from cardiogenic shock if you didn't act. She was in the medication station on the 4th floor, 1:22 a.m., verifying a 50 mg fentanyl order for a post-op patient in Bay 6, when Dr. Whitfield swept in with his phone pressed to his ear and his surgeon's coat unbuttoned over designer clothing that cost more than most people's monthly rent. The attending physician. The cardiothoracic chief. The man who had built his entire career on board connections and the kind of institutional authority that came from having a brother-in-law who served on the city council and a wife whose family had donated the entire cardiac wing in 1997. He did not see Elena immediately. He was too busy talking, his voice pitched loud enough that everyone in a 3-meter radius was forced to hear him. "I don't care about the protocol," he was saying. "My judgment supersedes the protocol. That's what attending means. That's what the title carries. These residents think they can question me during grand rounds." One of them today couldn't find a femoral line on her 3rd attempt. 3 times. And when I suggested she wasn't ready for that responsibility, she looked at me like I'd insulted her mother. The entitlement. The complete lack of respect for the hierarchy that keeps this hospital running. He ended the call and turned to grab a coffee cup from the station's tiny break area, and that's when he registered Elena's presence. His eyes ran over her, the generic scrubs, the pulled-back hair, the absence of any indicator that she was anything other than the background staff that kept the trauma floor operational. His gaze sharpened. Something about her positioning, perhaps. Something about the way she was holding the medication vial with a kind of precision that suggested actual training, the kind of grip you learned in a field environment where dropping something could cost you a patient. "Nurse," he said, and the word came out with a particular inflection that made it clear he had no idea what her name was. "You're new." 2 months, Elena said. She did not look at him. She was documenting the fentanyl administration, filling out the verification forms with methodical care. "Have you been through the new medication verification protocol?" Whitfield was asking. He was testing something. She could hear it in his voice, the way his tone had shifted from casual dismissal to something sharper, more strategic. The one we implemented for night shift specifically? Yes. And you understand that these procedures exist for a reason. That they exist because people with actual training and expertise have determined that they are necessary. He was watching her now with the full weight of his attention, and his presence seemed to take up more space than his body should have occupied. I've been doing cardiothoracic surgery for 23 years. I have an MD from Johns Hopkins, a fellowship from Massachusetts General, and I serve on the credentialing committee for this hospital. So when I see someone who is not a doctor engaged in judgment calls that belong exclusively to physicians, I notice it. Elena completed the form, placed the fentanyl vial back in the locked medication cabinet, and turned to face him directly. When she did, her eyes carried the kind of absolute emptiness that comes from having seen things the human mind was not designed to witness. She did not blink. She did not speak. Do you understand? Whitfield pressed. Crystal clear, Doctor, Elena said. Her voice had not changed pitch or inflection. She was already walking past him toward the patient bays, her hand steady, her heart rate unchanged, her entire body communicating the unmistakable posture of someone who had absorbed criticism and insult so many times that it had become background noise. Behind her, she heard Whitfield's footsteps stop. She heard him process the interaction. She heard the moment he realized that whatever he'd been attempting, the intimidation, the hierarchy assertion, the power play disguised as professional concern, had simply passed through her without leaving a mark. This, she sensed, was a problem he had not anticipated. The Grand Rounds presentation started at 7:22 a.m. on a Tuesday, which meant the attending physicians gathered in Trauma Conference Room B with their coffee still steaming and their defenses still lowering. Dr. Whitfield stood at the head of the polished oak table with Elena's charting pulled up on the wall-mounted screen, page after page of her meticulous documentation from the night shift. He adjusted his cufflinks, those expensive Italian ones his father-in-law had given him, and smiled the way a surgeon smiles before delivering bad news to a family. This, he said, his voice carrying the practiced condescension of someone who'd never been told no by anyone who mattered, is what happens when nursing staff attempt to exceed their scope of practice. The room fell silent. 23 pairs of eyes turned toward Elena, who stood in her assigned position at the back corner. She wore her scrubs without wrinkles, her badge clipped precisely center-left, her hands holding her tablet with the steadiness of someone waiting for an elevator. Her dark hair was pulled back in a bun so tight it could have served as a neurosurgical incision site. Whitfield zoomed in on one of her charting entries. Notice here, he said, tapping the screen with his laser pointer like he was prosecuting a case, she documented a probable pulmonary embolism based on clinical presentation. Probable. A nurse does not make diagnostic suggestions. A nurse documents observations and reports to the physician. Instead, what we see here is overreach. Dangerous overreach. Elena's jaw remained level. Her breathing unchanged. A resident sitting near the front, a young woman named Dr. Chen, glanced back at Elena with something that might have been sympathy before Whitfield's next words erased it. What's particularly concerning, he continued, is that this charting becomes part of the legal record. If something goes wrong with a patient, this kind of unprofessional documentation makes our entire department look incompetent. Whitfield had been at Cedar Creek Medical for 9 years. Long enough to know that power wasn't about being right, it was about who agreed with you. The 3 board members he'd played golf with last month were long enough. The chief of medicine owed him a favor from the time he'd supported the administrator's daughter for her residency interview. That was more than long enough. He'd spent a decade building a network that held him up at precisely the moments when he needed it, and he knew exactly how to activate it. Elena turned a page on her tablet. The fluorescent lights above hummed their constant mechanical pulse. She'd been called worse things in Pashto under mortar fire. She'd been called worse things in her own command structure. A physician's professional disappointment registered somewhere below the noise of a diesel engine idling in her memory. The grand rounds continued for another 14 minutes. Whitfield cited for more entries from her charting, each one blown up and dissected and declared excessive. The room filled with the particular kind of silence that happens when no one wants to defend the person being dismantled. Elena watched the back of Whitfield's head and felt nothing. Absolutely nothing. That evening, around 11:33 p.m., she was in the break room waiting for her coffee to finish brewing when Whitfield walked in. The fluorescent strips above the vending machines cast everything in that particular shade of institutional blue-white that made everyone look like they were already dying. He was loosening his tie, ready to head home to his house in Gladwine with its circular driveway and its heated pool. He saw Elena at the coffee machine and his expression shifted into something almost playful. Almost cruel. "So I was thinking about something," he said, walking toward the vending machine. "The way you documented that patient yesterday. It reminded me of something my wife said once." He opened the machine, selected a package of almonds he didn't want, just to have something to do with his hands. "She said nurses are like people who read the instructions to a recipe but think they're the chef." He laughed. A real laugh, the kind that carries through a room and expects others to join in. Elena selected her black coffee. Nothing else. The cup filled with a soft metallic hiss. She lifted it to her lips. The temperature was 187 degrees. She drank it. Whitfield waited for a reaction, a flinch, a flush, some indication that the barb had landed. The anticipation was the point. The room was empty except for them, but he spoke as if addressing an audience. "Nurse is playing doctor," he said to the vending machine. "It's actually dangerous, when you think about it." Elena walked past him toward the door. Her footsteps made no sound on the linoleum. Her coffee cup didn't rattle in her hand. Whitfield's jaw tightened. He'd missed. He'd set the hook perfectly and she'd simply walked through the water as if it couldn't touch her. 3 days later, at 2:06 a.m., Sergeant Moss spiked a fever. His post-operative orders from Whitfield had restricted him from certain antibiotics due to what the chart indicated was a documented allergy. Elena reviewed the admission paperwork, then the surgical notes, then the allergy section again. The allergy notation was there in Whitfield's handwriting. Penicillin. Nothing else. But there was no mechanism listed. No adverse reaction type documented. She called up to the floor to verify. The nurse on duty, a woman named Valerie who'd worked with Elena for 6 months without ever making meaningful eye contact, confirmed that Whitfield had verbally stated the allergy during rounds but hadn't specified anything beyond the label itself. Elena approached the computer terminal in the nursing station to request a clarification from Whitfield. She was calm. She was professional. She was executing her job with the precision it demanded. She wrote, "Allergy notation incomplete. Requesting clarification on reaction type for penicillin allergy. Sergeant Moss currently at risk for sepsis. Clinical presentation suggests infectious pneumonia. Current antibiotic regimen insufficient." Whitfield read it at 2:38 a.m. when the alert pinged his phone. He was awake. He was always awake. His marriage had fractured along the same lines as his sleep schedule, him checking emails until 1 a.m., his second wife checking herself out at 2 a.m. with their daughter. He called the floor directly. The overhead intercom crackled at 2:41 a.m. and his voice came through with the particular sting of a man who decided this was the moment to establish final authority. "Tell Martinez to stop practicing medicine without a license. That allergy is documented and it stands as documented. If she makes one more suggestion about patient care that exceeds her scope, I'm calling security to escort her out of this hospital." The intercom clicked off. The floor fell quiet. Elena was standing 3 feet away from the speaker when it happened. Valerie looked at her with something like pity. Elena's jaw clenched exactly once. The muscles along her temple tightened for a duration of approximately 0.6 seconds. Then nothing. She set down her pen. She returned to her charting. She did not flinch. She did not cry. She did not retreat. She simply continued working. Whitfield had activated the first phase of his network strategy without fully realizing he'd done it, the display of institutional power, the threat of security involvement, the clear message that challenging his authority would have consequences. He'd expected something different from her. Some reaction that would validate his need for escalation. Instead, he got silence. The room went so quiet you could hear the 4-pump beeping 3 rooms down the hallway. Elena finished her shift at 7:18 a.m., clocked out, and placed her badge in her locker beside those worn combat boots, the ones with the creases that would never fully disappear, the sole of the left boot still stained dark with blood that had turned brown over a decade of storage. She drove home through Philadelphia's pre-dawn traffic and lay in her apartment on a mattress that had no frame, staring at the ceiling and feeling nothing. She'd been ordered to disappear after Marjah. Ordered to become invisible. Ordered to live as a person who'd never been born. She'd done exactly that for 11 years. She'd learned how to absorb insults without reacting. She'd learned how to be dismissed. She'd learned how to be nothing. What she hadn't learned was how to exist in a world where that invisibility could be weaponized against her by a man with 9 years of institutional loyalty and 3 board members in his contact list. But that invisibility was about to become her greatest asset, and Whitfield had no idea that the moment he'd drawn his first weapon, he'd activated the one protocol that neither he nor anyone else at Cedar Creek Medical could possibly predict, because nobody there knew who she'd been before she became just another tired nurse working the night shift. The facility-wide lockdown alarm bleeds through the psychiatric ward at 2:13 a.m., 3 short bursts, then the siren's steady wail. Elena doesn't look up from the medication cart. She's counting capsules with the same mechanical precision she once used to count ammunition in the dark. 30 years of muscle memory doesn't care about fluorescent lights or patient charts. 30 years of muscle memory doesn't sleep. The psychiatric patients begin the low-level panic that always follows lockdown announcements. Doors hiss shut. Magnetic locks engage with a sound like a rifle bolt slamming home. One patient, a man admitted 6 hours ago with acute agitation and severe disorientation, admitted because he'd tried to carve his own name into his forearms with a piece of broken mirror, starts screaming about helicopters and underground tunnels. Elena has seen that particular flavor of psychosis before. Seen it in the eyes of men who'd watched too much and couldn't unsee it. She secures the medication cart with a practice motion, wheels it back toward the locked dispensary. The ward is controlled chaos now, nurses moving patients back to rooms, orderlies checking window locks, the kind of systematic response to crisis that hospitals practice like drills. Elena's movements are economical. No wasted motion. No panic. Just protocol. Staff Sergeant Derek Moss is in room 347, 2 floors down in the trauma wing, still unconscious from his surgery. Still breathing through a ventilator that hisses like something living. She hasn't been assigned to his room since her shift started, but she knows he's there the same way a compass knows north. The tattoo on his left arm reads Martinez in block letters. The man wearing that tattoo has no idea who she is anymore. The motorcycle accident that brought him here also took his memory of the woman who'd carried him 3 miles through Taliban crossfire with a dislocated shoulder and a Taurus 9mm in her waistband. The lockdown announcement crackles again. This time it's different. Security breach, South Corridor. An incident, location unspecified. Elena's hand pauses for exactly 1 second. An incident. In a psychiatric ward during lockdown, incident means something got through. Something got a weapon. She hears the commotion before she sees it, a crash like a tray hitting tile, someone shouting, the particular chaos of a patient in active crisis moving through a space where medical staff are trained to de-escalate, not defend. The disoriented man from intake is moving down the south corridor like something broken and dangerous. His hospital gown flaps. His left hand is wrapped around something metal. Something that glints like a threat. A cafeteria knife. Serrated edge, 8-inch blade, sharpened on what looks like concrete. He's moving toward the elevators with the specific determination of someone whose mind has declared war on the external world. Elena's breath doesn't change. Neither does her pace. The man makes it 3 more steps before he reaches the trauma wing entrance. The security door hasn't locked yet, there's always a 3-second window, always a moment where protocol fails because humans move faster than systems. He slips through. His eyes are animal bright, fixed on nothing and everything at once. Room 347 is directly ahead. Elena is moving before her conscious mind catches up with her legs. Not running, running draws attention, running makes noise. Walking with purpose. Walking like someone who belongs in the crisis, not someone reacting to it. Her shoes are silent against the linoleum. The knife wielder doesn't see her until she's 3 feet away, and by then his attention is already through the window of 347, already fixed on the shape of Derek Moss unconscious in his hospital bed, machines keeping him alive, and something in the disoriented man's mind has decided that this particular sleeping body represents something he needs to destroy. He moves into the room. Elena moves faster. The blade comes up in a gesture that looks like muscle memory from someone else's war. There's no hesitation in it. There's only intention. Elena's left shoulder takes the first impact, the knife punching through fabric and skin with a sensation like ice and fire occupying the same space. Pain registers as data. Pain is information. The blade finds something deeper than fat, something with nerve endings that scream in a language older than language. She doesn't flinch. She doesn't cry out. She rotates into the strike instead, using the knife wielder's own momentum to pivot him slightly, just enough to angle the next blow. If there's going to be a next blow, it won't reach Derek Moss. Elena's mind has already made that calculation. Her body is already executing it. The second impact comes across her ribs, not deep, not with the force of the first strike, because her positioning has compromised his leverage. Blood soaks through her scrubs, warm and immediate. The sensation is familiar in a way that suggests she's felt it before, maybe in a place where mortar fire shook the ground and there was no hospital waiting at the end of it. "Step back," she says. Her voice is different now. Lower. The octave has dropped like a stone. It's not a request. It's not a question. It's the voice of someone who'd given orders in languages he doesn't speak, who directed 17 people through crossfire with nothing but a radio and the sound of her own breathing. The knife wielder turns toward her. His eyes are still animal bright, still fixed on something that isn't in this room. Elena's right hand moves with the precise geometry of something that was drilled into her neural pathways until it became automatic as breathing. Controlled wrist lock. Pressure point at the radial nerve. The knife falls like it was never attached to his hand at all. It clatters against the tile with a sound like a period at the end of a sentence. The man drops 2 seconds later. Pressure point release. He's unconscious before his body hits the floor, not damaged, not harmed beyond recovery, just simply shut down by someone who knew exactly where to press and how hard to push. Elena turns. She turns and Derek Moss is standing, or trying to. Standing in the way of someone who survived trauma surgery, whose left arm is bandaged from shoulder to wrist, whose surgical site, the left anterior thoracotomy that saved his life, has just been reopened by the violence of his own fall as he tried to get out of the bed and reach for something, anything, in the chaos. Blood is pouring from his reopened incision. Not a slow seep. A flood. His heart is exposed at the surgical site, not literally, but close enough that Elena can see the problem before the monitors can announce it. His blood pressure is dropping. His oxygen saturation is dropping. The rhythm on the cardiac monitor is beginning to break apart like something mechanical losing cohesion. He's in cardiogenic shock. He's crashing. And he's crashing because he tried to get up, tried to move, and tore through surgical work that was the only thing keeping him alive. Elena reaches for the crash cart before anyone else in the hospital even realizes there's a second emergency in room 347. The monitors are screaming now. The nurses are pouring in. Dr. Whitfield will arrive in approximately 90 seconds. She can calculate this the way she calculates everything, based on data and distance and the specific speed at which a cardiothoracic surgeon moves when his patient is dying on his watch. But Elena doesn't have 90 seconds. Derek Moss doesn't have 90 seconds. He's got maybe 2 minutes before this becomes a funeral instead of a miracle. She's wearing gloves now. Double gloves. The blood on her own shoulder, her own ribs, doesn't matter. Protocol is clean technique. Protocol is separate yourself from the emergency. Elena's hands are steady as she opens the surgical site, as she locates the arterial bleeding, as she reaches into Derek Moss's chest cavity with fingers that have never trembled and begin direct cardiac massage, her hand directly on his heart, compressions that are separate from the machine, more precise, more controlled. Something that civilian medicine almost never does but military medicine knows is sometimes the only thing that saves your soldier when the bleeders are internal and the clock is running. Direct compression, she says. Numbers follow from her mouth in a steady stream. Anterior mediastinal bleed. Need type O negative, massive transfusion protocol. ETA on surgical team. Dr. Whitfield is one of the nurses. Etta. Elena's voice doesn't rise. It just cuts through the chaos like a blade. Numbers. Give me numbers. 3 minutes. Maybe 4. For minutes is a lifetime when you're doing cardiac massage by hand. Elena's fingers move with the specific rhythm that keeps oxygen moving through Derek Moss's body while his own heart doesn't. Her left shoulder is screaming. Her ribs are screaming. The blood from both wounds is mixing with his now separate streams becoming one. Oxygen, she says. Monitor the Saturday. Talk to me. 68% and holding, a nurse responds. There's something in her voice, surprise, maybe recognition, definitely the particular tone of someone watching a nurse do something a nurse shouldn't know how to do. Keep talking. 72. Elena's compressions don't change rhythm. Don't vary. Like a human metronome. Like something that was built to do this one thing perfectly. 79. The cardiac rhythm on the monitor is beginning to organize. Beginning to find order again. Elena can feel it through her fingertips, Derek Moss's heart responding to the stimulus, the pressure, the force circulation. The blood vessels in his chest aren't torn. The bleeding is controllable. He just needs to stay alive long enough for a surgeon who isn't her to fix it. 85. Dr. Whitfield appears in the doorway with 2 surgical nurses. His face is already mapping the problem, already calculating solutions. And then he sees Elena's hand inside Derek Moss's chest. Sees the direct cardiac massage. Sees the woman in scrubs and combat boots and blood, her blood and his blood mixing, doing the one thing that protocol says doctors do but reality says sometimes only someone with actual battlefield experience knows how to do. She meets his eyes for exactly 1 second. 1 second is all she allows herself. 88%, another nurse says. Heart rate's organizing. Sinus rhythm establishing. The room goes so quiet you could hear the ventilator breathing, patient and mechanical, the sound of machinery doing the job it was designed to do. Nobody moves. The silence lasts exactly 3 seconds. Then Dr. Whitfield steps forward to take over the surgical site, and Elena steps back, her left arm suddenly too heavy, her rib suddenly too real, blood soaking through fabric and dripping onto the floor in a rhythm that matches no monitor, follows no protocol, and tells a story that nobody in this room is ready to hear. Her hands moved on their own. Left palm pressed flat against the sternum. Right hand braced on top. Push. 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 The rhythm automatic as breathing, learned in a desert 2 continents away where there were no surgeons, no monitors, no time for protocol. The ventilator wheezed its mechanical rhythm as blood, his blood, her blood, indistinguishable now, pooled on the surgical drapes. Get a crash cart, Whitfield snapped, shoving her aside with his shoulder. She didn't move. Didn't step back. Didn't acknowledge the shove as anything other than air displacement. I said move, Nurse Martinez. She continued the compressions. 1, 2, 3, 4. The same cadence she'd used on Staff Sergeant Derek Moss 3 miles through Taliban crossfire in Marjah when his femoral artery had been severed and there was nothing but her hands and his name tattooed on her shoulder as collateral for a promise she'd made in blood. The monitors climbed. 72. 84. 91. Epinephrine. 1 milligram for push, she said quietly. I'm the attending physician here. Yes, sir. Epinephrine. Now. The resident's hands shook as she administered the drug. The line was a thread holding back the tide. Elena's shoulder screamed, the stab wound had reopened, threads of stitching tearing from the violent motion of compressions, but pain was information. Pain meant the wound was still bleeding. Bleeding meant she was still alive. Both of them were still alive. Sinus rhythm. The monitor beeped its confirmation. Steady. Strong. Real. The room went dead silent. Whitfield's face had gone the color of old bone. He stared at the monitor, then at Elena, then at the patient whose chest she'd just restarted by hand. His mouth opened. Closed. Opened again without sound. How did you, he started. Elena released her hands. Blood dripped from her gloves onto the floor. She looked at the resident. Get him stabilized for the OR. Page cardiothoracic. Tell them we have a grade 3 liver laceration and myocardial perforation. I want continuous cardiac monitoring. Yes. The resident moved without questioning. Elena pulled off her gloves. They stuck to her hands, wet with blood that had soaked through her scrubs. Through her undershirt. Dripping down her ribs in a line she could follow from collarbone to waist. The wound in her shoulder had split open. She could feel it. Cool air on exposed tissue. The sting of exposed nerve. Whitfield stepped toward her. His voice had changed. Quieter. More dangerous. You performed an unauthorized surgical procedure on a patient in cardiac arrest. I performed life-saving intervention on a patient in cardiac arrest. Using techniques. Techniques that required training. Military training. His eyes had narrowed to calculation. This wasn't anger anymore. This was strategy. This was a man recognizing the thing he needed to destroy before it destroyed him. You used your badge. Your credentials. I saved his life. You violated hospital protocol. You exceeded your scope of practice. He pulled his phone from his pocket, already dialing. You're done here. Elena didn't respond. She simply walked toward the door, leaving a trail of her own blood across the tile. One of the nurses moved to help her. Elena held up a hand. Don't. The message was clear enough. By the time she reached the break room, Whitfield had already made his first call. She could hear him through the walls, thin walls, no privacy, the entire hospital a fishbowl with him as the one holding the net. 3 board members, she heard him say. Yes. I need to activate the performance review protocol immediately. There's a potential scope violation. Patient safety issue. Yes. I'm gathering documentation now. He was good at this. She had to give him that. Not a screaming tantrum. Not a direct confrontation. Just a phone and a network and institutional power activated like a weapon. She'd seen it before in different uniforms. Same principle. Same ruthlessness. By the next morning, he'd contacted her nursing school. Her references. The admissions office where she'd submitted falsified credentials under a false identity because a woman officially erased from military databases couldn't exist on any legal paperwork. He'd brought in an outside risk management firm from Philadelphia General, a woman named Catherine Marks who specialized in building termination cases thick enough to withstand litigation. They'd interviewed 7 staff members. They'd photographed the surgical site. They'd pulled her entire training record. The combat boots in her locker were only the beginning. Whitfield had ordered a complete equipment audit. Security had found nothing else, she'd been too careful for that, but the boots were enough. Combat boots. Military issue. Worn like they'd walked through actual war, because they had. Because Elena had walked through actual war in those boots. When Dr. Whitfield came for her badge, he brought security. He brought Catherine Marks. He brought a printed document listing unauthorized personnel, scope violation, and fabrication of credentials for employment. You used false documentation to gain hire at this facility, he said, his voice the careful tone of someone reading charges. You performed unauthorized procedures outside your competency level. You endangered patient safety. Elena looked at the badge in her hand. Looked at the printed document. Looked at the man who'd spent 48 hours weaponizing every institutional lever he could reach. You're right, she said. His eyes widened. He'd been prepared for argument. For tears. For the performance of denial. Not for acceptance. Not for a woman simply handing over her badge and nodding. Turn it into security, Whitfield said. You're suspended effective immediately pending final termination. She turned it in. Cleared her locker in 12 minutes. Took the cardboard box with her name written on the side by someone in HR who'd never met her. Inside, 3 pairs of scrubs, a water bottle, a granola bar, the photograph of her and Moss after Marjah with their faces burned in shadow. And the boots. She placed them carefully on top, their laces curled like sleeping animals. The drive to the parking garage happened in segments. One hand on the steering wheel. One hand pressing against the wound in her shoulder where the stitches had torn completely. The elevator down 4 levels. The car a grey Civic she'd bought with cash in 2019, anonymous as Shadow. She sat with the engine off. Battery already dead from the parking light left on. It didn't matter. She wasn't going anywhere. The pain medication had worn off around 3 in the morning, and now the wound in her shoulder was screaming, not metaphorically, but screaming, a white-hot line of sensation that made breathing difficult. The ribs weren't broken, but they were certainly cracked. She could feel that too. Could feel everything now that the adrenaline had finally burned through. The rain had started around midnight. Philadelphia rain in late September, cold and relentless, hammering the windshield like judgment. The discharge papers sat on the passenger seat, formal notice of termination, effective immediately, with a final paycheck of $847 that wouldn't cover her apartment for even 1 week. She pressed her forehead against the steering wheel. 23 years. 3 tours. 2 countries she still couldn't discuss. A Bronze Star. A Silver Star. 2 Purple Hearts. The Navy Cross. All of it classified. All of it erased. All of it officially not happening to a woman who officially did not exist. And she'd walked away from all of it, taken the order to disappear, assumed the identity of Elena Martinez, a nursing degree purchased, references fabricated, history constructed like a building made of cards. She'd done it to be invisible. To heal people without headlines. To save lives without explaining why she knew how to save them. And she'd saved Staff Sergeant Derek Moss's life twice. Once in Marjah carrying him 3 miles through crossfire. Once on the surgical floor of Cedar Creek Medical, her hand still carrying the knowledge her military training had burned into muscle memory. And they'd fired her for it. The cardboard box sat on the passenger seat next to the discharge papers. She could see the boots. Could see the photograph underneath them. Could see her own past looking back at her from a face that didn't belong to this parking garage, this hospital, this life she'd tried so hard to construct. She reached for the boots. Almost threw them out the window into the rain. Almost let them hit the asphalt. Almost let 23 years of her own existence wash away in the Philadelphia downpour. But she didn't. She held them. Just held them. The leather worn soft. The laces frayed. These boots had walked through Fallujah. Through Jolin District. Through Sanjin Valley in Helmand Province. Through the worst hours of her own life. They'd never let her down. Not once. Her eyes burned. But soldiers don't cry. The phone in the cardboard box buzzed. The phone that wasn't supposed to exist anymore. The phone that had a Pentagon direct line someone had supposedly deactivated. She almost didn't look at it. Then the hospital intercom came to life above her, audible even in the parking garage. Not a code announcement. Not a page. Just a voice, security to Trauma Bay 2. Security to Trauma Bay 2. Something was happening in the hospital. Something urgent. She was no longer part of that urgency. And then she heard it. First one. Then a second. Then a third. The sound of helicopter rotors cutting the air above Cedar Creek Medical, the rhythm unmistakable if you'd ever been in a war zone. She knew that sound. She knew it in her bones. The rotors grew louder. The transport arrived at 3:48 a.m., federal marshals flanking a stretcher that held a man with desert-scarred skin and eyes that had seen too much violence. The prisoner intake was routine: guards, paperwork, the mechanical shuffle of a system processing the dangerous. Elena was 3 floors away, sitting in the break room with her discharge papers folded into quarters, staring at a cup of coffee she'd forgotten to drink, when the alarms started. Not cardiac alarms. Security alarms. The kind that meant a detainee was moving through corridors he shouldn't be in. She didn't move. That wasn't her problem anymore. Nothing here was her problem. The voice carried through the hospital's intercom system, not English, but Dari, the language of Helmand province. Words she recognized like scars she couldn't touch: Kartilat Ulzil, Kartilat Ulzil. The Shadow Killer. The Shadow Killer. Her hand stilled on the table. That name belonged to someone who officially didn't exist. By the time she reached the trauma bay, 6 marshals had the prisoner restrained to a bed, and Dr. Whitfield was barking orders with the kind of authority that came from a practice run, competent enough in the safe moments. The prisoner kept his eyes on the doorway, on the space where Elena now stood, his mouth working around that same phrase. Kartilat Ulzil. Kartilat Ulzil. Boots on tile. 1, 2, 3, 4. The security guard who moved toward her was 63, with a scar that ran from his left eye to his jawline, the kind of scar that only came from one place. His name tag read Martin, former Navy. His eyes, when they met hers, went pale. He stepped back. 3 measured breaths. Then he walked to the nearest hospital phone and made a call. "Sir, I need to report a presence. A military presence. I'm looking at her right now." His voice came out steady but stripped of everything except certainty. "Yes, sir. I'm certain." Her rank. He turned to Elena, and something in his posture shifted, the subtle realignment of a man looking up the chain. "What was your rank?" Elena didn't look away from the prisoner. The prisoner who kept saying her name. "Master Chief Petty Officer." The security guard's hand trembled on the phone receiver. He repeated it 3 times. Like he was translating between 2 languages that shouldn't exist in the same space. The general arrived by helicopter. Not a request. A command. 2-star insignia on his collar, and he moved through Cedar Creek Medical's corridors like he owned the building's foundation. Behind him came 2 uniformed officers with a sealed folder that bore classification markings that made Dr. Whitfield's face drain to the color of old surgical gauze. "Master Chief Petty Officer Elena Martinez," the general said, his voice carrying the weight of someone accustomed to being heard in rooms full of chaos. "Bronze Star for Valor under fire. Silver Star for direct action in the Marjah district during Operation Enduring Freedom. 2 Purple Hearts. Navy Cross." Each citation read like a bell tolling. "And a commendation signed by JSOC Command that states," he paused, his eyes moving to Dr. Whitfield, then back to Elena, "that you will be offered immediate restoration of security clearance and full rank restoration upon emergence from operational cover." The room went so quiet you could hear the ventilator in bed 3 working its mechanical rhythm. Then Staff Sergeant Derek Moss, lucid now after his emergency thoracotomy, lifted his left arm. The tattoo caught the fluorescent light. "Martinez." Block letters. Permanent ink on permanent skin. "She carried me 3 miles, Moss said, his voice rough from the endotracheal tube they'd pulled an hour ago. 3 miles through crossfire. Dislocated shoulder. TBI she never reported. Refused extraction until every man in the squad was mobile." He let his arm fall back to the bed, careful of the dressings. "That's who's standing in your trauma bay." Dr. Whitfield opened his mouth. Closed it. opened it again like a fish pulled from water, gasping for air that wouldn't come. His hand started shaking, not with restraint, but with the pure unfiltered panic of a man watching his institutional power collapse in real time. She falsified her credentials, she never disclosed, I had no way of knowing. You had every way of knowing, the general said quietly. You chose sabotage instead. The FBI arrived at 4:06 a.m. with warrants and body cameras and the particular authority that came from federal jurisdiction. They didn't announce themselves. They just walked in with badges displayed like weapons and placed Dr. Whitfield under arrest for falsifying medical records, conspiracy, and fraud. The charges came in a measured recitation that made the trauma team step back, creating space like a predator was moving through them. What they uncovered in his office was worse. The forged termination documentation. The fabricated incident reports. The deleted security footage from the psychiatric wing showing Elena's defense of Moss, footage he'd ordered scrubbed from the system. Everything meticulously organized, cross-referenced, and timed to bury her reputation in the exact moment her wound dressing needed changing. The handcuffs clicked with terrible finality. They walked him past the vending machines where he'd laughed about nurses playing doctor. The nurses didn't say anything. They just watched. 12 of them, standing silently along the corridor, their hands clasped in front of them, their eyes tracking him like a funeral procession. His face was the color of old newspaper. His medical license suspension came through while he was still in the holding cell, a text message from the state board that required only 3 minutes of deliberation. Elena's first day as Director of Trauma Services, she placed the worn combat boots on the shelf behind her desk. The leather was cracked from 15 years of operations across 3 continents. The soles were scarred from Marjah's broken streets. She didn't hide them anymore. She positioned them where she could see them during her rounds, a reminder of who she'd been when nobody was supposed to know, and who she'd chosen to become when everyone finally did. Through her office window, the parking lot filled at 6:22 a.m. 50 operators in formation. Not in dress uniform. In combat fatigues, boots bloused, their movement synchronized like a single organism. From the 160th SAW Night Stalkers. From 1st SFOD Delta. From SEAL Team 3, Charlie Platoon. All of them standing in a salute that started at their chests and rose to their foreheads, held for 48 seconds while the morning light broke across the parking lot. Elena watched them from behind the tempered glass. The trembling wasn't fear. It was the sudden release of 17 years of restraint, the cost of being invisible finally translated into something visible enough to touch. Her right hand pressed flat against the window. She didn't wave. She didn't smile. She simply stood there as the soldiers stood there, acknowledging the moment when hiding stopped being survival and became a choice. The transformation was complete. The timid night nurse with steady hands and careful silence had been replaced by someone who didn't apologize for knowing how to save lives. The rank she wore was on a badge now, visible, official, irrevocable. And every patient who came through Cedar Creek Medical's trauma bay would be treated by a woman who had already faced the worst this world could offer and chosen to save rather than destroy. The soldiers lowered their hands at precisely the same moment. So here's the question, when the people you've protected stand at attention for you, are you finally allowed to stop protecting yourself? Because Elena Martinez had spent 17 years carrying secrets that could have destroyed her career. She'd taken a knife to the ribs to save a man who didn't recognize her. She'd lost everything trying to do it the right way, the quiet way, the invisible way. And in the end, it took federal charges and a general and 50 operators in formation to prove what the nurses already knew, that sometimes the most dangerous person in the room is the one nobody's watching. Make sure you're subscribed and hit that notification bell, because next time we're breaking down exactly what happened to Dr. Whitfield during his federal trial. Like this video if you believe heroes don't need recognition to be heroes. Comment below, would you have stepped back into that trauma bay after being fired, or walked away for good?